Hello, everyone. So, we are going to be talking about perpetrators this week and different types of perpetrators that exist and different interventions that help to work with perpetrators of IPV. So, how we work with perpetrators has a lot to do with the answer to this question. Why do batters batter? Now, if you'll remember, one of the first PowerPoints, one of my pet peeves is using the why question with victims. So why do they stay? That's because it's a very blaming question. Now, with perpetrators, I'm okay with using the why question because the blame should be put on the perpetrators. So there are a couple of different theoretical approaches when you look at the research regarding batterers intervention. So we're going to talk about these different theories pertaining to what causes some of the violence. So the first one is social and cultural theories. So these attribute IPV to social structures such as patriarchy in society and cultural values that legitimate male control and dominance over their domestic partners. So this is a lot of what we saw in the misrepresentation video in terms of social and cultural ideologies. Feminist interventionists are based on women's experiences of these social and cultural factors and use education and skills building to re-socialize batters, emphasizing equality in intimate relationships. So then you have a family-based theories. This theory looks at the violent behavior based on the structures of the family and family interactions rather than on an individual within the family. So family system interventions emphasize building communication skills and may involve the use of couples counseling with the aim of family preservation. So there's a couple concerns with this theory. Family systems interventions are less common than other types because many practitioners, and rightly so, object to treatments that do not assign blame to the batterer. So this family system theory looks at, again, the whole family as a problem. And because this intervention approach may transfer some responsibility for the battering to the victim or endanger the victim if not performed consciously. So I never recommend couples counseling when there is an abusive relationship going on. Oftentimes, when you think about it, a therapy session is supposed to be very intimate, it's supposed to be very safe, and it's designed to be very safe. And so if a victim feels safe opening up and sharing some of her thoughts about the abuse, oftentimes we have found that endangers them even more later on because they pay for it once they get home, and so the therapy session is not a safe space for them, and it can be more dangerous for them. Then you also have individual-based theory. So these attribute domestic violence to psychological problems such as personality disorders, the batterer's childhood experiences, social learning theory, biological disposition, things like that. And that's where psychotherapeutic, cognitive behavioral, and attachment abuse interventions are based on this theory. And so treatment models for batterers. It's difficult to do a one-size-fits-all approach for batterers intervention because it does not accommodate those different types of batters that we will learn about that enter the criminal justice system. And so there's new trends that have come out that are more specialized approaches to working with batters. Interventions tailored to a specific type of batter. based on their psychological factors, their risk assessment, substance abuse history, different things like that. And then also interventions designed to enhance program retention and efficacy with special populations. So the Duluth model of batterer intervention is one of the primary ones that we hear about in working with this population. And so the change of privacy and secrecy, which often surrounds IPV and instead makes it public, makes communities safer for victims and often holds offenders accountable for their behaviors. The Duluth model is a hybrid of feminist and cognitive behavioral principles. So oftentimes arrest and prosecution coupled with court-mandated intervention with group work is the Duluth model is what oftentimes is used when they are seeking treatment. One of the things that practitioners are very careful about is we want to avoid like DSM or other type of diagnoses because this isn't something that is a mental health diagnosis by any means. This is conscious behavior that they are choosing to do. Male-only groups are safest and most ethical means of helping men take responsibility for changing their behaviors. Similarly, female-only groups would be appropriate for female offenders. And usually it's administered over a period of 6 months or more. There's some states, I think like California, that require like 9 or 12 months in weekly 1.5 to 2 hour groups. And so again, using the Duluth curriculum, it uses feminist principles integrated with some CBT interventions as well and changing their thought processes. We see oftentimes a pattern of behavior, and that is a learned pattern of intimidation, coercive control, and socially sanctioned behavior against women. It oftentimes is the process of re-educating participants in a structured manner by confronting them about their sense of gendered entitlement and sexist attitudes towards women. Also, identifying and confronting their minimization and denial of abuse and challenging them to be fully accountable and take responsibility for their choices and their behavior. So again, a lot of the interventions look at CBT as a form of treatment and changing some of their thought processes. A CBT approach conceptualizes IPV as a consequence of problems with the person's thoughts, assumptions, beliefs, and behaviors. The underlying idea of those operating from a CBT paradigm is that violence is used because it is functional for the person using it. It works. That is, the batterer uses violence against his partner to reduce his inner tension, to achieve victim compliance, and to end an uncomfortable situation, and or to give the batterer a feeling of power and control. So a CBT approach uses batterer's intervention focus on behavioral skill building, role playing with the intent of reducing anger, conflict management, and increasing positive interactions, such as active listening and or nonviolent assertiveness. The biggest things that I hope that you have taken from this class already that you've learned is battering is about power and control and dependency and insecurity, immaturity, fear, and anger. And there are different types of batterers. So you have an antisocial batterer, you have a dependent batterer, and you have a borderline batter. And so each one of those has different beliefs and different motivations for battering. So I've also included the PowerPoints for each of these 3 types of batters in Blackboard as well. So please take a look at those. I hope this has been helpful for you guys this week. If you have any questions, please feel free to shoot me an email, and I look forward to your weekly discussion boards. Thank you guys so much.